felt like I've just got to try harder, work harder, do more exercise, spend more time with my therapist, meditate more. And you address this in your welcome video on your website, where there are a lot of people like me who do try a lot of things, but ultimately it gets to the point where sometimes we need more. Hello, I'm Dr Jodi Richardson, and you're listening to, well, Hello Anxiety, a podcast where we end the struggle with anxiety and build our toolkit of practical skills to thrive. Hello, thank you for joining us for another episode. What I love most about today's guest is that as a psychiatrist, Dr. Warren Kane cares deeply about getting to know his patients. He really wants to take the time when he meets with any patient to understand their concerns, how their mental health is impacting their life, and he understands how overwhelming it can be when you're experiencing anxiety, you're reaching out for help, and you don't get the time that you need with a medical professional to really have your questions answered and to feel confident that the support and the direction that you're taking is exactly what's right for you. What Warren does for his patients is very special. He doesn't rush them. He allows extra time in their appointments, and his approach to medicine, psychiatric care and general care of his patients really stems from his own personal experience in his family, where a family member, his dad in particular, didn't receive the care that he needed, and ultimately that could have ended up in it did end up in a very serious situation, but thankfully his dad's okay. But isn't it interesting that we often make our work from our wounds? And I think Dr. Warren Kane comes to us as a medical practitioner who's been on the other side, seen what difference it makes when a medical practitioner doesn't take the time with a patient. And of course, he also knows the difference it makes when they do. So Dr. Warren Kane joins us all the way from Las Vegas in Nevada, which he will pronounce Nevada in the United States. And so, Warren, thank you for joining us today. It's just a delight to be able to bring your wisdom and experience to this beautiful community.
Thank you so much, Jodi. I really appreciate the opportunity to just be a part of this. So thank you so much again for having me on.
Oh, that's just honestly my pleasure, because you're the first psychiatrist that I've had an opportunity to have a conversation with. And when people think of a psychiatrist, I wonder if they do what I do, which is I understand a psychiatrist is a medical professional who is trained in mental health, but also qualified to prescribe medication. Perhaps my first question for you is, could you please talk to us about your work and what you'd really love for people to understand about your role and about medication for anxiety?
Yeah, absolutely. So to tell you a little bit about my work, I'm a private practitioner here in Las Vegas. I'm a psychiatrist, meaning that I own my own business and I'm the sole practitioner there. And so I'm able to really dictate the kind of quality of care that, I wish everybody was able to receive. So in my clinic, I spend about 90 minutes to 2 hours with patients during their initial intake. Every follow-up is at least 45 minutes long. It's a really great opportunity. And, something that I would like your listeners to kind of know about out there is that in regards to anxiety, I like to say that, it's treatable, right? There's a lot of great treatments out there. Medications can be super helpful. But most importantly is, having that relationship with your provider so you guys can have like a educational discussion about what options are the best for you.
Yeah, when you talk about your approach, it's very different in that here in Australia, and we do have a global audience here, but a lot of my listeners are Australian. We have generally our appointments when we first reach out for help with our mental health, we tend to go to our general practitioner or a family doctor. I really like to encourage people to book a double appointment, but a double appointment with a GP is 30 minutes. And it's very, very different to know that once somebody is referred to you, I presume are patients referred to you, Warren, from a GP?
Yeah.
Yep.
Well, yeah, it's a little bit of both. So in America and probably in Australia too, we kind of have a complicated health system in the fact that patients have insurance. or they don't have insurance. And even if you have insurance, you can choose not to use it. And so in my practice, I actually don't take insurance, which allows me a lot more flexibility. The insurance companies really bind our hands. They tell us how to practice. They tell us what medications to prescribe. By being an out of network physician, it gives me a lot more autonomy to provide that care I want.
Oh, I love that you can do that. And that's a very different healthcare system to ours here, where we have Medicare. And so we can get rebates on appointments, especially with a mental health care plan. So it's important for listeners here in Australia to know that if you are referred on to a psychiatrist or a psychologist, that if you have a mental health care plan developed by your family doctor, that you are entitled to some rebates, because cost can be so prohibitive, can't it?
Oh yeah, absolutely. It's not only the cost here in America and everywhere, right? It's also kind of the system in a whole too. We're really not educated on it, by our employers, or we don't really have this kind of common knowledge of, yeah, we have to go to that general practitioner, then we have to get a referral, or what is the best way I can see a psychiatric professional, right?
Mm, yeah. So having you here today to talk to us and to help our listeners understand what what is it what's different about the way that you can practice as a psychiatrist or a psychiatric professional compared to a psychologist.
Yeah, absolutely. So in America, we always confuse these terms all the time. And to be honest, a lot of people will contact me thinking that I'm a psychologist. But, at the essence of it, we're both technically doctors, right? Many psychologists have a PhD. Many physicians or psychiatrists have either an MD or a DO here in America. Um, as a psychiatrist, I've gone through not only undergraduate training, but I've also gone through medical school. And then I've also completed a psychiatric residency, which is about 4 years long, in 4 years long just for the residency. I would say that psychologists mostly focus on therapy. Psychiatrists can do therapy as well. But what really makes us unique is we are able to prescribe medications. We have a firm understanding of the human body, human anatomy, and the way the medications impact a person. So that's the main differences.
Mm. And here, what we know is that if you need a medication prescribed, some GPs feel confident and comfortable doing that, and that's a frequent occurrence. But some don't, and patients might see a psychologist but also have a psychiatrist to help monitor their medication use. And particularly that's the case here for young people who are prescribed medication, that a lot of GPs will really want to be working alongside a pediatrician or a psychiatrist as well. So can you tell us, please, what would you love people to understand about medication for anxiety?
I think I would like to, if I could, put one thing out there is that, again, I think medications for anxiety can be super helpful, right? There's a lot of medicines out there that have profound impacts on my patients for the good, right? On the same token, it's always helpful to speak with that mental health professional, the psychiatrist, in order to find what medication best suits you, right? Typically a lot of people work through different algorithms kind of in medicine. Like I'll start with one medicine, I'll go to another, I'll go to one after that. But what becomes dangerous is that there's some medications out there that really treat anxiety well, but they can have very severe side effects, and a lot of patients don't know that, right? And so if they see a doctor, they get started on this medicine that may be super helpful for the anxiety, they may have long-term consequences that they never anticipated.
What sort of consequences might they be?
Well, here in America, one of the medications that are commonly prescribed by general practitioners, I would say more than psychiatrists, although psychiatrists do prescribe these, are what we call benzodiazepines. And I don't know if you're familiar with them, but benzodiazepines can be super helpful for panic attacks. They can be super helpful for anxiety attacks. They're usually used on an as needed basis. The way benzodiazepines work is very similar to maybe how alcohol works, right? And so, if anybody out there may drink alcohol, you know that over time, if you keep on drinking and drinking, you kind of build up a tolerance to that, right? And so, the same thing happens with when you're taking a benzodiazepine, is that you can build up tolerance. And what this does is it not only helps your anxiety, but the medication, because it impacts your whole body, you'll start to notice other things in affecting yourself, right? And patients commonly become dependent on the medicine. They'll need higher and higher and higher dosages just to get the same effect. So again, this is a great treatment for anxiety, but it really shouldn't be the first line treatment that you seek.
Yes, and is an example of a benzodiazepine Valium.
Yes, very similar. So yeah, Valium or lorazepam, Ativan, these are all different types of medications out there that are, really desirable for a patient and a clinician, right? So I know that this medicine will work almost immediately, and I know it will work almost 100% of the time. And I want to get my patient better, right? As a clinician, of course, I would love to prescribe this medicine. And for a patient too, I want my anxiety gone immediately, right? I want to get on as fast as possible, and this medicine helps a lot. But as you mentioned, in Australia, you may only have 30 minutes with a patient. In America here, commonly GPs spend about 15 minutes with a patient. So imagine trying to talk to your patient, not only talk to them about starting a medicine, evaluating them, making sure they have anxiety, but also talking about the risks and side effects. Many clinicians fail to do that.
Yes. And a person who feels anxious going in to talk to a general practitioner will likely feel overwhelmed and emotional, and it's hard to articulate exactly what you've been experiencing, equally when you're feeling like that as when you're feeling rushed. And so that's what I love about the podcast is that these are opportunities where people can listen to episodes in their own time and can go back and I was going to say rewind. That shows my age, doesn't it? Can go back and re-listen and learn more so to be better prepared when they are approaching a mental health professional, but also be more informed about what's available. One of the things that I'm very open about with my podcast and as a speaker is my own journey with medication. And I am medicated using an SSRI, and it's actually generally termed an antidepressant. And I wonder, and I know that at the dosage that I use, that it's it's been very helpful for my anxiety because it's enabled me to settle my anxiety to a point where I can really adopt the strategies that I put into practice. And whilst I'm not anxiety free, and that's not what this podcast is about, it's about being able to dial it back and really live a really full life with anxiety. Could you talk to us about if a patient is prescribed an antidepressant for their anxiety, could you help us understand how that works? Because some people get a bit confused. Well, I don't have depression, or do I? Why am I being prescribed this particular medication?
Yeah, absolutely. So the antidepressant is just a terminology that just came up within psychiatry, and SSRIs are relatively new when we talk about the treatment for anxiety and depression. But what we know is that when we prescribe these medications, they in fact do lower anxiety scores. They lower depression scores by altering the serotonin in our system. What's very interesting is prior to the SSRIs, we've always, I would say, historically, for the most part, we've treated anxiety and depression very similarly. So before the SSRIs, there were medications called tricyclic antidepressants. And again, tricyclic antidepressants can be very helpful for the treatment of anxiety. And before tricyclic antidepressants, more for depression solely, but some for anxiety, were the MAOIs. And the thing is with the MAOIs and the TCAs, not to get too far off topic, is that they had a ton of side effects. Where the SSRIs, although they have side effects out there, they're much less as compared to the older medications. And so SSRIs, and there's a couple other classes, SNRIs, or even other anxiolytics, can really treat anxiety, but SSRIs are the usual go-to for many professionals.
Yes, and just for those of you that we're using an acronym that we both understand, I've just realised, but it's selective serotonin reuptake inhibitor. And Warren, could you talk to us about the fact that we're not actually taking serotonin when we're taking an SSRI? Could you talk to us about what's happening in the brain when we're taking these medications?
Yeah, at its simplest core, the way I like to explain it to patients is that overall it increases the amount of serotonin kind of in our system, in our brain. So a reuptake inhibitor blocks the reuptake of serotonin in our body. And our bodies are a very complex but also very efficient system. Serotonin is a neurotransmitter. When we release it in our brain, we want to recycle it, right? And so a reuptake inhibitor prevents the recycling. Therefore, there's more serotonin in your brain, right? And so, in essence, that's how it works. And that's how it really helps with anxiety and depression.
Thank you. I love that. That's how I've explained it in the past myself because I think I know there is reticence, and I was reticent also when it came to taking medication. Goodness, I reflect on where I'm sitting at the moment. It's funny, isn't it? Because we often know exactly where we were when significant events happen in our life. And I remember I was hospitalised after having our second child. I was admitted into a mother baby unit because my mental health was uh, really there were significant mental health challenges for me, and so my little baby girl and I were put into hospital, and I started to get some treatment. And I remember having conversations with my psychologist from my bed, and I remember the nurses saying, really suggesting very strongly that I would benefit from medication. And on reflection, I know I really would have, but I was breastfeeding, and I was really afraid of what taking that medication might mean for my baby's future health. And so I remember getting the script, driving home from the hospital when I was discharged, going and getting the script from my GP, going and filling it, coming home, taking one tablet, and then going into a real panic because I was so unsure about the decision that I was making. And I knew it wasn't the tablet that caused the panic, it was my uncertainty around the decision that I was making. And I know that for a lot of people, when it comes to medication, there are lots of different points of view that you will see about why it's a choice a lot of people don't want to make for themselves. Could you share with us some of the objections that you come across with your own patients?
Yeah, there's a lot out there, and I can really identify with my patients, and that's what I really love about my clinic is I really understand where people are coming from. Because to be honest, I would be an individual that I don't want to be on any medicines, right?
Mm,
Medicines at times can sound scary. Um, and so, what I was going to say is, a lot of times people will come to me first saying, I don't even have anxiety. And, I kind of ask them, well, why are you here? And then they tell me, and it sounds like anxiety, but there's a little bit of that disconnect, right? Between, oh, do I actually have the diagnosis? Because if I have the diagnosis, I might need the treatment. And that's usually
mm,
one of the main things that people will tell me. Another thing, too, is they're afraid of the side effects. Maybe they tried an antidepressant before, an anti anxiety medicine before, right? Maybe they had such negative consequences or negative side effects that they don't want to start another one. And so they're asking me, what else can I do to improve my mental health, right? There's just so many out there, but I would say those are the most common.
mm. Yes, I know that I've experienced, these objections myself. And when I talk to people, I'm not qualified to discuss medication in any specific ways, but when people ask, I direct them to the people that can have those conversations with them, that there is a place for medication, that it's but that also when we are taking medication, that it's advised that it's in conjunction with other strategies to really support you with your anxiety. What do you say to people who might think that anxiety medication is the only road to take, and that there's that reticence about connecting with a professional who can also meet with them regularly to support them as well?
Yeah, I think it's just a reflection kind of on our society these days. It's like I want it for those who are willing to take a medicine and only want to take a medicine. A lot of times they just want to kind of simple fix in a sense, right? If I take a medicine, it'll all be gone. This will be better. You know, but what ends up happening is when we look at the research, when we look at the data, I'm highly evidence based. Is that what we see is that when patients only have therapy, they do better than no therapy. When they have medications, they do better than no medications. But when you really combine these two modalities together, people do far superior than any of the groups out there. Now, one of the issues that comes up for me or comes up for my clients is that they just don't have the time for therapy, right? And so that's also something to consider, right? And again, it kind of goes back to the main thing is you really want to prioritize your mental health as best as possible, right? It affects so many different parts of our lives. I really encourage people, try to take that hour a week or hour every 2 weeks or hour a month to do therapy. And, also try to take your medications consistently, right?
Mm, that's such good advice because the the thing about the medication that I understand is that it there's a half-life of the medication. The medication is active, then it starts to break down. And of course, that's the same with any medication we need to take regularly, is that it's no longer able to do what it's designed to do once it starts to break down. And that's why we need to be regular and consistent about when we take it and about being able to take it on a daily basis. And so I know also that the advice is if you are coming off medication, it's really important to taper. Can you talk to us about why that matters?
Yeah, absolutely. So maybe there's two things I can address if that would be okay. And it kind of goes hand in hand. But one of the important things to know related to kind of half-life and how it works, right? This is how our body digests and processes the anti-anxiety medicine, is that it takes about 4 to 6 weeks to work. I think that's really important for people to understand out there, is that it's going to take time for an SSRI to really work as compared to the benzodiazepine we talked earlier about in the show. But I would say, give it a little bit of time for it to work because it just takes that 4 to 6 weeks to really ramp up into your system to fully take an effect kind of in the brain. The same reason applies to why you have to taper. Is that if you taper or you discontinue or you pull the medication away immediately when you're at such a high dose, people end up getting a withdrawal. Again, our bodies are really complicated, but also really efficient. And we're always kind of in harmony or in sync with each other, right? And so if you pull a medication away that is having such a profound impact on your brain is going to feel that shock, right? And so people can have rebound anxiety, they could actually have rebound depression, they can have, chest pain or increased heart rate. So it's really important to discuss with your medical professional, with your psychiatrist or GP, that if you're considering changing a medication or even wanting to discontinue, that you do so in a really safe manner.
Yes, I love that you've addressed the notion of the time it takes for it to become effective. And I remember when I finished breastfeeding, I remember I my journey with medication is complex, like a lot of people's is. I remember I was undiagnosed with my mental health. I had anxiety for around 20 years before I experienced major clinical depression. And I did take medication at that time whilst beginning therapy. And then I felt so much better. I did the classic, I feel so good. I don't need this anymore. And weaned myself off it only to sort of fall back into that dark hole. And that was the point where I thought, look, I really want to understand more about my mental health. I want to take a break from the medication and work with my psychologist to understand more. I think I felt like there's got to be a cause and effect. Like if I find out the cause, then I can deal with this. And that was a long journey of growth and challenge and difficulty. And then becoming a mother, I experienced postnatal depression with our firstborn and then with our secondborn. Obviously, I got help with the second time around. But when the children were really little, I remember having a conversation with my husband because I'd been refusing to take anything. I really felt like I can do this myself. And I felt like taking something was failure. That's really how I felt. And I know it's not rational, but there was a real part of me, I think, as a really driven person who had been able to solve a lot of problems and challenges in life and be very successful doing the things that I'd done up to that point. I felt like I've just got to try harder, work harder, do more exercise, spend more time with my therapist, meditate more. And you address this in your welcome video on your website, where there are a lot of people like me who do try a lot of things, but ultimately it gets to the point where sometimes we need more. Sometimes we need more. And that was, I think, when Peter and I had a conversation and it was brought to my attention in a really calm way how I will be able to cope better as a mum, but the impact of my improved mental health on the children and everyone around me was the impetus for me to go, oh, this is just not about me anymore. This is about the way I interact. And that was really what got me over the line. And it was life-changing to make that decision, to take the medication and to be able to really use all the strategies I'd been learning for the previous sort of 15 years. And so I don't have plans to go off my medication at all at the moment. That's certainly not something that I intend on doing because I'm thriving. But could you tell me, for people like myself and others who wonder whether or not our medication will be for life, or parents listening who have children who are medicated, is it something that you see patients on forever? Is it something that is a challenge for people if they are going to be on it for the rest of their lives? Or is it common for people to be on it for a period of time and then wean off and move on without it?
So I think that's a really great question because I get it all the time. And, I would like to just preface this question out there that, I'm not your doctor out there and you should seek professional help and advice, but I will give, the general answer, right? And hopefully that can
Yes.
provide a little bit of help and a little bit of information. So in regards to medications, what we typically say in kind of the psychiatric world is, somebody has anxiety or depression and they require the treatment of a medication. We typically want them on that medicine for at least 6 months to a year long. At that time, we can consider kind of going down on the dose, of course, working with your mental health professional. However, if there's a rebound anxiety or depressive episode, either generalized anxiety disorder or depressive episode, we typically say that you should be on that medication for life, right? And that's at least what we say here in the US. And the reason why we say that is just because, we've already trialed it once and we've looked at many different studies. Even if we were to taper it later again in life, there's a high likelihood that you'll suffer another depressive episode or again a recurrence of generalized anxiety disorder. Now, why I think it's best to talk to a psychiatric professional is there's so many small nuances in this, right? Because that's kind of the general framework we work around, but everybody is different, right? And so someone might come up to me saying that they have anxiety, but what we really find is at the core of the situation, maybe there was a huge stressor in their life, right? Maybe it was related with a family member, related to work. Maybe it was so profound. And again, maybe, we try a medication and we come down and there's a little bit more of that anxiety, related to that stressor, to the thoughts related to the past. Well, if able to work it with their psychotherapist or with their psychologist on it, there is a possibility in the future that we can come down again. So that's why, again, work with your psychiatric professional to find out what works well for you and what your goals are. That's what I really try to do in my practice, which really makes me different from other psychiatrists out there, is I try to listen to my patients and really understand what they want. If somebody wants to trial off their medications, I'll tell them the risks, the benefits, but in the end, it's their healthcare, it's their body. And sometimes I take the perspective that if I'm not there kind of giving them this information or walking them through this, then ultimately they may just go do it themselves, right? Or they may go out to another professional who doesn't even know about this.
Yes, and it's empowering to have information. It is empowering, and like you say, that if you don't have the time with somebody who can really listen, understand, and is qualified to be able to have these conversations, people can make decisions where they don't have all of the information that they might need that will really support them to make the best decision for themselves. And I appreciate this so much because it's a question that comes up for me when I'm presenting and educating, and I'm cautious about what I will say, and I will share with the audience about my own journey, but that it is a conversation to have with somebody who can really help you to make those decisions. And an episode like this is so helpful because to, today, as we record this and as people listen in their own time, there are answers to questions that they may not have had before. Some people listening will be on medication, many will be, others will be considering it, others will be facing the question of, is this a decision I make for a child in my family who may be struggling with their mental health, particularly as we sort of move through the end of the pandemic-ish, maybe, hopefully. Yes, fingers crossed. So when it comes to questions of how the medication is going to make a person feel, I know that some people will say, I don't want to be artificially happy. I don't want to feel numb. I don't want to not feel anything, because what we know about being human, and because of my training in acceptance and commitment therapy and our approach around changing our relationship with our thoughts and feelings and our anxiety, is that anxiety shows up around what we care about. We feel anxious often and have distress and challenges with how we feel when things are really meaningful to us, like in families, with our work. So, how do you talk to patients who feel as though if I take something, my emotions will be false, or my emotions will be uh, different in a way that won't enable me to feel fully human?
Hmm. Yeah, no, I think that's a great question. Again, these are wonderful questions because I get them all the time. Because I think it's a concern for everyone out there, right? It would be a concern for me if I was thinking about starting one of these medicines. I would say more often than not, kind of from a medical point of view, what I hear from my clients is that when they're taking an antidepressant, or they may be new to an antidepressant or an anti-anxiety medicine, right? Is that they may feel more numb, right? More numbed, more blunted, we call in medical terminology, but they're just not really getting kind of, that life, aspect, those emotions. And what I typically try to tell my patients, my clients, is that, this is always a risk. In fact, there may also be a risk that it may make anxiety a little bit worse, right? But again, this is so important why you're with me, why we have a good relationship. For me in my clinic, I'm a very conservative psychiatrist. I would tell you out there, there's a lot of other psychiatrists a lot more aggressive than me. What I tend to like to do is I'll start on half the starting dose, or maybe just the starting dose, depending on the client, to see how they do. We give it time to work, right? And slowly we'll go up if needed to find that happy medium, right? I would say a lot of people out there, if they're seeing their general practitioner, if they're seeing their primary care doctor, or another psychiatrist who's a little bit more aggressive, those psychiatrists out there may give you a moderate to medium dose, right? Because your anxiety is moderate to medium. And then they'll say in 4 weeks, up your dose. Or, or keep it the same. It depends on you, right? They'll give you kind of these, instructions that are kind of hard to interpret, right? Especially if you're not a medical professional. What ends up happening, though, is what ends up happening is if you're on this moderate to medium dose, and then you go to even higher dose, right? And you do this, like I said, within 4 to 6 weeks before the medicine doesn't even have time to work. A lot of times, those people will get a lot more side effects than anyone else out there, right? The blunting, yeah, everything.
Yes, and it's so interesting that you make that reference to the dosage may very well be prescribed related to, understandably, the needs of the patient and where they're at. And I recall I started, and I will choose not to name the medication I'm on or the dosage that I'm on, because I don't want to share that information, only because I would like people to confer with their medical professional, and the medical professional to be the one that directs them as to what's the best medication for them. But I started on a quarter of the dose that I'm on now, and it was a very gradual shift, and it took months, obviously, to start on the dose and then reflect and keep visiting my GP to have those conversations. And ultimately, I am on a dose now that is a stable dose and won't change. But what I also know from my own personal experience is that I can draw on the skills. And when I say I draw on my skills, Warren, the skills that I share with my community here, and that I teach, and that a lot of my guests have taught, are being able to observe and recognize how my body reacts when I'm feeling anxious, that I can see it coming, and I have grounding strategies that I can put into place, like dropping anchor, like using my breathing, and also a willingness to go, right, well, I'm feeling anxious. What is this telling me? Something important's happening. I feel anxious every time I interview someone on the podcast because it's important to me to do a good job and to ask the right questions and to support people who are listening. And so that idea that, anxiety can't hurt us. It's awful. It feels horrible and it can feel overwhelming, but it's not dangerous in itself. And so because of my medication, I have a little bit of space to be able to see what's happening and put strategies into practice. And of course, I talk a lot about exercise as well. But I also know that when something happens in my family and our son had a terrible biking accident and had a lacerated liver, and this was in 2021, just at the end of lockdown. And we're in Melbourne, and so we experienced one of the longest and most isolating lockdowns in the world at that time. So it was a very difficult time psychologically. But the day before schools opened, he had a grade 3 liver laceration, and I know you'll understand how serious that is, and was on the cusp of needing surgery. Well, believe me, I felt it. I experienced it. The tears, the worry, the catastrophic thinking, so it's not like I don't still experience anxiety and big emotions and reactions, but I am better placed to be able to manage and cope. And day to day, I'm able to manage and cope. But I certainly did experience and do experience tears and grief and sadness, and I think that's very much about finding the right dose, isn't it, for the person's needs?
Yeah, absolutely. And I really appreciate you sharing that story with us. Yeah, I can completely understand it, right? And like I would say is, kind of taking my doctor's hat off, right? My physician hat off, to putting on my like human hat, right? Is that, anxiety, depression, sadness, tears, they're all human emotions, right? And these are what we experience on a typical day-to-day basis. And again, that's why it's so important, like you mentioned, to find the right dose of medications that work for you. Because just as much as we don't want to feel blunted, numb to any of these emotions, on the other spectrum too, we don't want to feel overly anxious, overly depressed, right? So again, these medicines in combination, I would say, in combination with therapy, can help guide people more towards that middle, that happy medium.
Yes, absolutely. And I love that you've come back to that. And it's also interesting, I think, to talk about lifestyle because we certainly know that exercise as a prescription for anxiety is so powerful. So how do you talk about anxiety and help people understand, sorry, exercise? How do you help people to understand the power of lifestyle when it comes to mental health?
Oh, 100%. I think lifestyle and our understanding of lifestyle and how it impacts mental health is continuing to grow. But, at its basic core, what we've always kind of used it is always kind of in a remedy in a sense, right? Exercise, eating healthy. Not only will this give us a better foundation to hopefully feel less anxious and less depressed, but also when we're feeling more anxious and depressed, right? By doing exercises, by engaging in breathing exercises or mindful meditation, it can really drive us. It can really lower and decrease the symptoms, right? So I always talk with my clients about these other things out there that can affect anxiety. And again, being sedentary, eating unhealthy, these are kind of risk factors for being anxious and depressed. But yeah, no, I think it's so important to really look at. The other thing that I was going to say is, you know, what I'd like to tell people out there too is that anxiety, although it's a mental health disorder, can be caused by other medical conditions too. And that's again why it's so important to go speak with your general doctor so you can get some lab work. And when we talk about depression, of course, it could be related to lower vitamin D levels. It could be related to anemias, which mean your blood count is a little bit lower than we anticipate. Anxiety could be caused by your thyroid, either too high, too low, right? And so it's so important for us that when we're feeling anxious, to really rule out all the medical conditions out there, right? Before we kind of jump into, treatment.
Yes, thank you. Thank you for addressing that. And one of the conversations I had recently with another guest, Anna Goldsworthy, was around perimenopause and menopause and hormonal changes and anxiety. So What would you love to say to the women of my age who are maybe experiencing anxiety for the first time, or it's really elevated because of hormonal changes? What do you recommend,
Well,
generally speaking?
generally speaking, well, the first thing I recommend, and I'm going to sound like a broken record, is to seek the advice from a professional, right?
Yeah.
Because there's so many things that could be happening. It could be hormonal. There could be other things happening in our lives too, right? And typically, when it's around that time, there may be other social things affecting our lives, which are causing the anxiety and the depression too. And the second thing that I would mention is just being open to treatment, right? Again, if this is your first time experiencing anxiety, which is maybe in the middle to later, years as compared to like younger years, right? You may be a little bit more afraid of starting a medicine, right? And kind of the stigma behind that. If we can kind of get beyond that, right? If we have those supports like you have, we could really kind of help accelerate the process of treatment. So that's what I would really recommend to people out there is just be open and try to seek care sooner than later. What I'd also like to say is, and what many people don't know is the longer that anxiety and depression goes untreated, typically it gets worse and worse, right? It usually doesn't get better over time. And what that means is when symptoms get worse and worse over time, it's actually harder to treat, right? And so, kind of a shift of thinking is if you're able to see a doctor or a psychologist or a GP earlier, you may need to be on medicines less, you may need to be on a lower dose. It actually might help you out long term.
Yes, and I know that you say in your own work, and I'll direct our listeners to check out your two videos. Are they just the two videos? I only looked at two on your website. Have you got? Yep, maybe more. Yep, two videos. So you'll really get to know Dr. Warren Kane a little bit more after listening by having a look at the videos on his website. But that I love your approach because I think if people come to see a psychiatrist, there might be this presumption that psychiatrist equals prescription. And that's not necessarily the case. And I think it's important for people to know that there are lots of ways, and you're learning on the podcast, lots of different ways that you can support yourself with your own anxiety and young people that you might work with or live with as well, and that you won't necessarily need a prescription. But until you seek the help and ask the question, you won't know what the best course of treatment is for you to get you the help that you need. And even a lot of people don't even necessarily need to see a professional for therapy. Sometimes people will go to the GP, and I remember going to the GP and I was medicated at the time, but my nan had passed away, and I dearly loved and still do my beautiful nana, and I was very, very sad and very, very teary, and I sat with that for a few weeks and really expressed how I felt and continued to do what was important, even though I felt so sad. But eventually I just thought, look, I'm just going to go and have a chat with my doctor and tell him what was happening. And he said, you know what? You're going through such a hard time at the moment, and you are having a completely normal reaction to a very sad event. And so I'm delighted that you came to talk to me about it. I know that this is a hard time. This will get easier. There's no need for us to make any adjustments. Come back in a couple of weeks or a few weeks if you're still feeling like you'd need to have another conversation. And he was able to really help me make that connection between big feelings and big life events, and that big feelings are very normal and they can be really difficult to cope with. And sometimes people need extra help, and sometimes you just need a reassurance to say, this is really tough. We know why you're going through this, and it's not going to be something that you'll be experiencing for the rest of your life. This will get easier.
Yeah, absolutely. No, I'm really happy that you share that story because it speaks to two things, I think. One is that it's so important finding a professional, right? Professional in any field that really is knowledgeable about what they treat or what they do, right? And so this GP did exactly what we would typically recommend, in our textbook per se is, the medical term is, bereavement to a certain degree, right? And it's a normal human reaction. Again, it can look so much like anxiety and depression just because the emotions are so strong, but it's normal and it will hopefully go away, right? Hopefully it go away. If it doesn't go away over a specific amount of time, then of course we can treat it with medications, but it's a human experience. The second thing I would say is, again, you want to find a right provider out there, not only to provide you with that normalization, right? Normalizing how you feel, but also to let you know and to fully evaluate what type of diagnoses you may or may not have, right? And so, a lot of things that I like to tell my clients is that, okay, you're coming in with anxiety, but the symptom of anxiety can be so many different things. There's so many anxiety disorders out there. There's generalized anxiety disorder, there's social phobia, there's social anxiety, there's PTSD, right? There's adjustment disorder. There's so many out there that will take on kind of this feeling of anxiety. If you seek a mental health professional, more likely than not, they're going to be able to pinpoint it a little bit more clearly. And what does that mean? That means the treatment is going to be a little bit more clear too.
Yes, that's exactly right. And oh, goodness, when it comes to treating different anxiety disorders, some are more stubborn to treat than others. I know OCD is one of those. Am I right in saying that? Yes. Yeah.
Yeah, absolutely.
Yeah.
OCD is, it's an anxiety disorder in my opinion, and it is sometimes very challenging to treat. Absolutely.
Yes, yes. Dr. Warren Kane, we have covered so many Q&As in this conversation. Before I ask you to share where people can connect with you and follow your work and learn more about your approach and your work, is there anything that you'd like to share with us that I haven't asked you about already? Any sort of parting words?
The only parting words that I would have for folks out there, maybe there would be two things. One is to really stay hopeful, right? Again, anxiety, depression, mental health, to kind of destigmatize it. It is a diagnosis that's absolutely treatable, right? So if you're suffering from anxiety and depression out there, I would really encourage you to seek out treatment, sooner than later. And just knowing that, the symptoms can be treated, right? They can go away. The second thing that I would really mention to those out there is, just seek out the supports that you have, right? Because that can be so helpful for us too, right? And you shared about your experiences and your relationship with your family. Being close to who we are and understanding a little bit of who we are too can really go a long way in understanding, maybe where that anxiety is stemming from, or maybe where that kind of depression is stemming from. So yeah, those would be it.
Oh, thank you for sharing about the hopeful approach and the hope that people can hold on to. And that's one of the things that I really appreciate you finishing on, because anxiety can be so debilitating and so paralyzing, and there is so much that we can do. It is manageable. It is treatable. The earlier, the better, as you say. And so, and what you've shared with us today will give so many answers to people who you've probably answered a lot of questions a lot of listeners might not have even realised they had, but would have arrived at eventually. Your expertise, your compassion, your approach is very special, and I'd really love for you to share with us, please, how can people learn more about you?
Yeah, absolutely. So what I would say is, you can of course visit my website. It's www.kanepsy.com, and I'm sure there'll be a link out there. Also, you can follow me on Instagram. I'm at Dr. Kane MD. And so those would be great places to reach out to me if you have any questions or any concerns.
Oh, thank you. And on Instagram, it's DOCTOR Kane MD. And Warren, thanks again so much for your time. It's been a real learning curve for me and a really special episode for our community.
Thank you so much for having me on.
Thank you. And thank you so much for joining us today. Thanks again. And if you think this episode will be helpful for somebody that is in your inner circle or outer circle or community, please share the episode. Then, little by little, we can extend this help to the people that need it. Thanks again for joining us, and I'll see you next week. Okay, bye. Thank you so much for joining me for this week's episode. If you enjoyed it, please subscribe and leave a review. To keep the conversation going, I'd love you to join me over on Instagram. You'll find me at Dr Jodi Richardson. Also, if you'd like a copy of my free 5-day mini email course, Calm Your Anxious Brain, then jump over to my website, drjodirichardson.com, and you can sign up down the bottom. I've really enjoyed having your company. Thanks so much. See you next time.